Hello dear students, Namaste. The topic for today is dry socket, also known as alveolar osteitis. What is dry socket? This is a painful dental condition which occurs after the tooth extraction. Dry socket is the most common complication of extractions, especially with mandibular third molars. Now, the mechanism for dry socket. As we all know that after extraction, there's formation of a blood clot. So if for some reason this blood clot fails to develop or dislodges or dissolves before the wound is healed, especially on the first day of extraction, this may lead to the formation of a dry socket as seen in the picture on the right. There could be a number of causes for dry socket, like spitting from the mouth or blowing through the mouth, heavy rinsing, sucking on the straws. So all these activities are leading to negative pressure in the mouth, and hence that causes the dislodgement of the blood clot. So patients should be advised no sucking on the straws, no spitting, no blowing through the mouth, no excessive rinsing. So basically any activity that can cause negative pressure in the mouth should be avoided after the extraction, especially during the first 24 hours. Then even heavy brushing and poking on the socket can cause the dislodgement of the blood clot. And of course, smoking. As we all know that smoking in general delays wound healing. So if the patient is a smoker, we should advise them to stop smoking completely for 3 days after the extraction at least, and if possible for 7 days. And last but not the least, when the patient replaces the gauze very frequently, that can also dislodge the blood clot. So we need to advise the patient to maintain a firm pressure on the socket by biting on the gauze piece for at least 30 to 45 minutes, and only after then they should remove the gauze or replace it if they would like it. There are some telltale signs that confirm the diagnosis of dry socket. First, the patient experiences severe, pulsatile, throbbing pain, and the characteristic feature is that this pain usually starts 3 to 4 days after the extraction. Seen clinically, we can see gray bone in the socket as seen in the picture on the right. And the socket is dry and empty looking because the blood clot is dislodged. The patient complains of unpleasant taste, bad breath, foul odor in the mouth. The pain radiates to ear, eye, neck, temple on the same side. Gums are swollen. There is no fever. And the patient has no relief with analgesics like Tylenol and Advil. Management. First and foremost, we need to reassure the patient that this is not an infection and it is pretty common, because I've seen the patients of dry socket, they return with severe pain. First of all, let me tell you that dry socket pain is really painful. And so the patients think that the socket is infected. So we need to reassure them that it's pretty normal and it's not an infection. And also that it is self-limiting. So whether we treat it or not, the pain usually subsides after about 8 days. Management is just palliative to relieve the pain and discomfort to the patient. So the first step in the management is irrigate the socket using monojet syringe and normal saline, which will remove all the food debris from the socket. Now that the socket is clean, we should pack a sedative dressing in the socket. Take a piece of surgery foam, apply dry socket paste on this, and pack into the socket. Alternative techniques include pack a piece of plain packing strip in the socket or pack alveogel. So either of these techniques work pretty well to provide relief from the pain and discomfort to the patient. Lastly, explain the patient and ask them to follow up as needed to change the dressing until the socket heals. That's all, dear friends. Thank you for listening. Keep learning, dear students. Best of luck and much love. You can comment your questions and video topics and suggestions below. Take care.